Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Ali Tressiter and Kevin Ziener.
This is the Ask an Audiologist podcast. For those of you who are joining us for our very first ever episode, the Ask an Audiologist podcast is made up of succinct podcast episodes meant to better inform patients about everything audiology related. Dr. Ali will break down articles written by her audiology peers, and I, as the layman, will hopefully ask relevant questions to provide an even clearer understanding of the subject matter. Today, we are going to be tackling one of the most searched topics on Ask an Audiologist, tinnitus. This article was written by Dr. Maura Chippendale, and she is the owner-operator of Chippendale Audiology in beautiful, sunny Cape Coral, Florida. Dr. Ali, why don't you christen this maiden voyage of the Ask an Audiologist podcast by getting into the nuts and bolts of today's topic? What is tinnitus?
So tinnitus, in its most basic form, is going to be the perception of sound in the absence of an external stimulus. So really, it could be you're in a quiet room, there's nothing making noise, but you hear a buzzing or a whooshing sound. Sometimes people hear a clicking sound. It can be any number of things, but it really is in the absence of an external stimulus.
Okay, so I have a question for you. All of a sudden, I turned 38. And not only was I getting older, but I started feeling older because out of nowhere, based on nothing, I started to hear high-pitched ringing. Nothing that was deafening, nothing that made me have to go to the ER, but it was probably for 5 seconds, and I did the first kind of dog thing where my eyes got big and I looked around. Would that be considered tinnitus?
So that's a great question. And so in order to actually make that diagnosis, I would have to ask you additional questions.
Ask away.
So the first would be, how long did you say it lasted?
5 seconds, 10 seconds max. And I did the thing where I hit my head like it was a old school television to try to correct the fuzz internally. So
that is not advised.
Okay.
So I would avoid doing that part in the future.
Copy.
So then my next question would be, did you hear a loud sound beforehand, or have you had a recent head injury?
Well, I feel like I've had many head injuries in my life, all self-inflicted, but no, prior to that, other than a calendar changing, I didn't think anything had happened of note. But I do listen to music a lot. Okay,
so when you say that, it really opens up the can of worms that is, tinnitus is incredibly complex and it involves a lot of different things. One of those things being, people who have anxiety or depression or are more prone to those things, they actually perceive tinnitus to be worse. And so when you say that, when you say, hey, I turned 38, part of me thinks, there could be a little bit of a psychological thing going on there where you thought, oh my gosh, I'm old. Mm-hmm. This ringing in my ears, you're anxious about it, and you're just kind of feeding into it. So that could be one thing.
I went on Dr. Google too much is what you're telling me.
You may have looked at Google just a little too much.
Fair enough. So what if there are people who are not like me, who who aren't trying to self-diagnose online, but who one day actually just wake up and either have, how would we quantify it? Light to severe to moderate forms of tinnitus. What can they do by themselves? But what's the ultimate strategy for them long term?
Sure. So the question you asked, you actually said, if someone woke up, if you're waking up with tinnitus and you've never experienced it before, that is actually something you want to get medical care for pretty quickly, because tinnitus, true tinnitus that starts and seems to last for a long time, that typically doesn't just happen when you wake up. It's usually something that occurs over time if you have exposure to noise. Sometimes with medications like blood thinners are notorious for causing tinnitus, but also things like red wine, the tannins in red wine, cigarettes, caffeine. So there are a number of things that can play into it. But if it comes out of nowhere and it stays, that would be something I would want to get care for right away. But if we're looking and we're saying, I've experienced this ringing in my ears. When I was in the military, I worked with a lot of patients who had tinnitus because they were exposed to loud sounds and explosions. In that case, there are a number of different ways we can kind of cope with the tinnitus. The big key here to know is that there is no cure for tinnitus. There's no over-the-counter pill. There's no drop. There is nothing proven to cure tinnitus. And sometimes tinnitus is actually just a symptom of something else going on, like I mentioned, medications or alcohol consumption or things like that.
So then my question, again, being the layman that I am, is I'm terrified because if I have this ringing sensation that seems to either remain the same or get worse, but as a doctor, you're telling me like, well, hey, there's nothing that I can actually give you that's going to cure the tinnitus. What is a real world expectation for somebody who is dealing with it or suffering from it? Like, what's the long-term plan? And I know it's going to be specific for each individual, but if we can kind of generalize it, what's the long-term plan for helping to treat tinnitus?
So that's a great question. So if we're ruling out these external sources that are causing tinnitus, and this is something that is long-term that you're dealing with, we kind of shift treatment to rehabilitation, to learning how to cope with tinnitus. Because again, like I mentioned, people who are more anxious in their life or sometimes deal with other mental health issues, they actually perceive their tinnitus to be worse, more bothersome, and some will say it even impacts their quality of life so much that they cannot sleep, they can't work. So when we have a patient that is that affected by tinnitus, we want to do a number of things. One, we want to help them disassociate that really negative feeling towards their tinnitus. And that can be done, through cognitive behavioral therapy. It can be done through tinnitus retraining therapy. There are a number of ways to really approach it. But that's kind of step one. Step two, we want to do a full comprehensive test battery and find out, is this just tinnitus that you're dealing with? Do you also have a hearing loss associated with it? Because often people who have tinnitus also have an associated hearing loss. And if, we find a hearing loss, then we can work on treating the hearing loss as well. And the number one treatment for hearing loss is hearing aids. And what's amazing about hearing aids is sometimes just by treating the hearing loss, that meaning, giving a little bit of volume where it's needed, the tinnitus can essentially go away. They can be relieved of the tinnitus. And so when you think about tinnitus and its association with hearing loss, I want you to think of, lighting a candle in a really brightly lit room, right? And so let's pretend that really brightly lit room, that is someone with normal hearing, right? And so if we light this candle, which the candle is tinnitus, if we light that candle in a brightly lit room, it doesn't really add much to the room, right? But if we dim the lights, so give the person a little bit of hearing loss, all of a sudden that candle is adding a whole lot more to the room. So really just putting hearing aids on that patient, making the room brighter, that in itself can alleviate the bothersome aspect of tinnitus. So that's another way that we can approach treatment. And, the treatment can be the same with ear level sound amplifiers in treating tinnitus, even in the absence of a hearing loss.
So I think that makes us all feel a little bit better, meaning, hey, tinnitus doesn't have to be the end of the world, because if you aren't actually suffering from hearing loss and the tinnitus isn't something that you're dealing with every minute of every hour of every day, it's just something that might occasionally flare up, you're probably okay. But if you notice it getting worse, if you're trying to rattle your head like I am, trying to shake those cobwebs or that sound out, and you're noticing it far more often than ever before, or it's some way inhibiting your life activities, that's when we should go see a professional for some short-term and long-term care.
Absolutely. And so you bring up a really good point in that, if it is something that it kind of happens randomly, lasts for 10 seconds at a time and then goes away, that is completely normal. Everybody has that. We call it transient ear noise. It is not something to be concerned about. Another thing that, maybe not be too concerned is, say you went to a really loud concert the night before. Well, I would recommend wearing hearing protection. Not everybody does. And so if you wake up the next day with ringing ears, that can just be because of your loud noise exposure the night before. But again, when you want to get care, is when you are perceiving that tinnitus, the ringing, the whooshing sound all the time, and it's actually inhibiting your ability to live a fulfilled quality life. That's when you need to seek care.
Love it. Well, thank you, Dr. Alley, for our first ever Ask an Audiologist episode. You did wonderful. A round of applause for Dr. Alley. She was nervous. She shouldn't have been nervous. She did a great job. And also a special thanks to Dr. Chippendale for today's article. And to learn more about tinnitus or any other audiology related topic, please visit askanaudiologist.com. And for Dr. Alley and myself, thank you so much for listening, and we will see you next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
Dr. Alley, vertigo, you go to talk to us about vertigo.